Hi, here we are, part 3. We're almost at the end, losing my voice, but we're at the end. We're just going to do the lower extremity and we'll be all finished with the highlights of all the muscles for your practical and next week's quiz. We're going to start with the lower extremity and we're going to learn the quadriceps muscles. So the quadriceps muscles, quad for 4, there are 4 muscles. In order to be able to study them on this model, I'm going to take Sartorius off. We will come back to Sartorius in a minute. We have, here's the medial side, there's the hallux. Medially, we have Vastus Medialis, we have Rectus Femoris, and we have Vastus Lateralis. Vastus Medialis, Rectus Femoris, Vastus Lateralis. If we take Rectus Femoris off, deep to that, we can see right here is Vastus Intermedius. All right? So Vastus Medialis, Vastus Intermedius, Vastus Lateralis, and then we put superficial to that, and we put Rectus Femoris back in, and then we put Sartorius back in, and we've got ourselves the anterior thigh muscles. So what are the anterior thigh muscles? Vastus Medialis, Vastus Lateralis, Rectus Femoris, deep to that Vastus Intermedius, and then crossing 2 joints from the hip, ASIS, anterior superior iliac spine, all the way down to the medial tibia. Look at that long strap. Follow it down and look where it goes, all the way to that medial tibia. There's your tibia bone. That's your Sartorius. So it's a long strap-like muscle that goes and cuts across 2 joints, so it's very special. So let's start with origin, insertion, and action. So rectus femoris, you definitely have to know origin, insertion, and action. Rectus femoris, the origin is anterior, inferior iliac spine. So here's your hip joint, and you remember anterior superior iliac spine, anterior inferior iliac spine. So rectus femoris, AIIS, or anterior inferior iliac spine, and the margin of the acetabulum, okay, the margin of the acetabulum. Insertion is going to be the tibial tuberosity as well as the patella. So patella is the kneecap, and there's your tibial tuberosity. In fact, all the quads, rectus femoris, vastus medialis, vastus lateralis, vastus intermedius, all of them are going to attach here. This is why when you get kicked in the shin right below your knee, it hurts like really bad. All right? So again, anterior inferior iliac spine, margin of the acetabulum is the origin. Insertion is going to be the tibial tuberosity and patella. Action, extends leg. So here it is, extends leg and flexes thigh. So if you want to exercise rectus femoris, you can do this exercise here, lifting the knee up. All right, so you're flexing the thigh, extending the knee. So flexing thigh, extending the knee, rectus femoris. Flexion of hip, extension of knee. Flexion of hip, extension of knee. That is the action. Okay, we move on to the next one on the list, Vastus Medialis. Vastus Medialis, as I mentioned, it's located medially. There's your hallux, Vastus Medialis. Okay, that's your rectus femoris, Vastus Medialis. So Vastus Medialis, the book will say linea aspera and intertrochanteric line. Okay, that's all on the femur, so keep it simple, stupid, keep it kiss, right? We're going to say femur. And insertion, as I said before, tibial tuberosity and patella, like the rectus femoris and all the other quads. All right, action, extension of leg and stabilizes patella. So, yeah, it's not going to flex the thigh. All right, that would be rectus femoris. It's going to extend the leg and stabilize the patella. All right, so that's Vastus Medialis. The next one on your list is Vastus Intermedius. Anterior and lateral surface of the femur is the origin. Insertion, like all the other quads, tibial tuberosity and patella. This one, intermedius, only extends the leg, no involvement with the patella. And then we have last on the list, Vastus Lateralis. Vastus Lateralis is going to originate from the greater trochanter, as you can see here. That's the greater trochanter, lesser trochanter. So guess what? Vastus lateralis is special. When you have hip replacements like I did, there's an issue with that because, you know, the origin is there, okay? So something to keep in mind. Vastus lateralis, origin is greater trochanter, intertrochanteric line, and linea aspera of the femur. So just put greater trochanter and femur, you're good to go. And then, of course, same as all the other quads, what's the insertion? Tibial tuberosity and patella. And what is the action? Well, the action is going to be the same as the medial. So vastus lateralis and vastus medialis will stabilize the knee along with extension of the leg. So extends leg, stabilizes knee. So who are the knee stabilizers? Vastus medialis and vastus lateralis. That's why when someone has a total knee replacement, working the quads is so important. You need to stabilize that patella. You need to strengthen it. If you're going to go into physical therapy, you better know these muscles. All right, so that's it. That's pretty much the quads, anterior thigh. Now we're going to go over the Sartorius, notorious. So notorious Sartorius crosses two hip joints, the hip joint and the knee joint. It's a long strap-like muscle that you can see here. It starts at the anterior superior iliac spine and attaches to the proximal medial end of the tibia. There's Sartorius. Crosses two joints, very special. So let's go over a little bit of detail. Where are you going to find this muscle in the book? You're going to find it on page 211, the chart, and then the figure is going to be on 212. There's your Sartorius, long strap-like muscle. I'll point to it again. Ta-da, right there. Long strap-like muscle, Sartorius. All right, so most people don't know that song. It's Depeche Mode, I love it. Okay, I'm old school. So what about Sartorius? Origin, as I said previously, anterior superior iliac spine. So here is your hip, and you're going to see anterior superior iliac spine is the origin. Insertion is going to be the aponeurosis, proximal medial portion of the tibia. Action, here it is. It does a lot. Flexion, abduction. So abduction, move the thigh away. Flexion, abduction, and lateral rotation of the thigh. So this is the one muscle that helps you cross your leg over like this. Okay, so I really had to work my Sartorius after I had my hip replacement. Check this out, very proud of it. I'm able to externally rotate my thigh. That's pretty good. All because I have rehabbed my Sartorius. I can rotate laterally my thigh, flex the leg, and abduct as well. All right, so we move on from Sartorius, moving away. And we go to Gracilis. This is about the only inner thigh muscle you need to know. Believe me, there's way more. There's pectineus, there's adductor magnus, adductor longus, adductor brevis. All you need to remember is Gracilis. So let's show you Gracilis. All right, so here's the thigh. So inner thigh muscle right here, long strap-like muscle. Can't miss it. There it is. Long strap-like muscle, Gracilis. All right. So Gracilis is an adductor. That's what it is. It's the adductor muscles. So origin is going to be inferior ramus and body of pubic bone. So pubic bone right here. And insertion, medial surface of tibia inferior to the medial condyle. All right. So there it is. You've got that medial condyle right here. So inferior to the medial condyle. And what does the Gracilis do? Adduction of the thigh, and also flexes and medially rotates the leg. So the main action is adduction, bringing the thigh back to the midline. Okay, so that's Gracilis. We move on to the hamstrings, and we're almost done. We have the lower extremity finished almost. Now, very easy to remember. Remember the hallux is medially, so medially you're going to have two muscles. One that's kind of peeking out from the deep, all right? So right here superficially is semitendinosus. The way I remembered it in medical school, semitendinosus is on top. On top of whom? Well, semimembranosus is deep to it. So right here you can see peeking deep to it is semimembranosus, and this is semitendinosus. Laterally, how do you know it's lateral? Because you could see your pinky toe here. Laterally, you see the biceps femoris long head. The short head can be seen right here peeking deep, all right, deep to it. So biceps femoris, long head, short head, semitendinosus, semimembranosus. And that's it. Those are your hamstrings. So now let's go over the details of origin, insertion, and action of that. Bear with me as I turn to the page. And where are you going to find it? You're going to find it on page 217. Voila. Okay, so there's the picture for it. And above you have the chart. How would you describe semitendinosus? The origin is ischial tuberosity, which you can see right here, ischial tuberosity of the hip bone. Insertion, medial aspect of tibial shaft, medial upper aspect of tibial shaft. And then what's it going to do? Extends thigh, flexes leg. Extends thigh, flexes leg. So these are the antagonists of the quads. They do the exact opposite. Semimembranosus, same thing. Origin is going to be the ischial tuberosity. So most of your hamstrings are coming from the ischial tuberosity. That's why a hamstring tear is so painful, because you can tear it off the ischial tuberosity. You can't sit, you can't stand, you can't walk. It hurts. All right, so semimembranosus, ischial tuberosity is the origin. Insertion is going to be the medial condyle of the tibia. Let me pull out the tibia. Medial condyle of the tibia. And lateral condyle of the femur. So the femur would be on top. Let's see, here we go. Lateral condyle of the femur. Okay, remember the epicondyle and the condyle. So there's the lateral condyle right there. Because that's the femoral head, that's medially, that's the lateral condyle. So medial condyle, lateral condyle, epicondyle. So that's pretty much going to be only medial condyle of tibia and lateral condyle of femur. Okay, so are you going to have to know that much detail? No, I'm just giving you the information. What you should know, though, is the action. It extends the thigh and flexes the leg. All right? Whew, almost there. Very exhausted. Moving on to car alarm. I hope that's not disturbing this video. Oh, they stopped. Good. We have finished the anterior thigh. We have finished the posterior thigh. We are finally coming down to the lower leg. We are not doing the foot, to my dismay, since I am a former podiatrist. But that's okay. We're not important until you hurt your foot. Anyway, let's go over gastrocnemius. Gastrocnemius right here. It has two heads. Proximally, it's along that popliteal area. Distally, it is continuous as the Achilles tendon, the strongest tendon in the body. And it attaches to the posterior calcaneus, as you can see. It attaches to the foot, helps you plantar flex the foot so you can jump, propulse off of your feet, get up on your toes, walk, all of that. So yes, we need our gastrocnemius. So gastrocnemius has two heads. All right, so the medial and lateral condyles of the femur are the origins. Medial and lateral condyles of the femur are the origins for the two heads. And then insertion is the Achilles tendon, also known as the calcaneal tendon. It attaches to the posterior aspect of the calcaneus, and it helps you plantar flex your foot. All right, now watch this. On your final exam, your practical, if we take this off right here, deep to it, you can see the soleus. All right, so gastrocnemius, if we just do this and we put a sticker on that, that's the soleus. In fact, they work together so much that sometimes we say gastroc-soleus complex. The soleus is going to be doing the same exact thing. It's a synergist. It is a helper. It definitely, most definitely helps gastrocnemius. So origin is proximal portion of tibia and fibula, as well as the interosseous membrane, which is a membrane that kind of holds together the tibia and the fibula shaft. And then, of course, it continues. The two muscles become one. They're married. That's why they're called the gastroc-soleus complex. And they become the Achilles tendon and insert to the posterior calcaneus. What does it do? Same as the gastrocnemius, plantar flexion of the foot. All right? So if I'm going to jump and plantar flex, it's the gastrocnemius. This is a game changer for athletes. If you rupture the Achilles tendon, it rolls up like a fruit roll-up. It will definitely need surgical intervention. If we fix it, it's only 80% tensile strength, so it is definitely sometimes a career breaker for athletes. Guess what? We're down to the last two muscles, and then I'm finished. Woo! Here we go. So the one muscle that causes shin splints, I'm going to highlight here. The rest of the muscles in the anterior leg, you do not have to know. The one muscle that you do need to know is quite easy to find. Why? Because it's the only muscle that has the tendon attachment on the dorsal aspect of the first metatarsal. There it is. Follow it up, and it hugs the shin, hugs that tibia, all right? And it's just right there hugging the tibia. So guess what? It causes shin splints when you're running. If it's in the anterior, what do you think it's going to do? It's lifting your foot up. It's dorsiflexion. That's how you get shin splints. From running a lot, you're lifting your foot up a lot, and those muscles are working real hard to lift when you're running. So that is Tibialis Anterior. In your book, it can be found on page 218 in chart format regarding origin, insertion, and action. And 219 isolates the picture right here. You can see Tibialis Anterior. And you can furthermore see how it attaches to the base, dorsal aspect base of first metatarsal, as well as dorsal aspect of the medial cuneiform. But you know, I'm a podiatrist, I know details. Just know if you're lost and you see all those muscles in the leg and you're nervous during the practical, follow the tendon. If it attaches to that base of the first metatarsal dorsally, that is your tibialis anterior. Because the rest of them are going to go to the toes, and that'll be extensor digitorum longus, brevis, hallucis. You don't need to know that, okay? All right, so tibialis anterior. In the book, it says lateral condyle, upper 2/3 of the tibia and interosseous membrane. That is the origin. And like I said, insertion is going to be dorsal aspect, base of the first metatarsal and medial cuneiform. Prime movement or prime mover is dorsiflexion of the foot. And that's pretty much it, dorsiflexion of the foot. I cannot mention anything else about the tibialis anterior or TA because that's all of it. All right, it causes shin splints. All right, last one. Can you believe it? Last one. This is the last muscle, and it's a muscle that you can see only laterally, so don't confuse it. See, if you see this, look on the lateral aspect of the foot and ankle. Follow it up, lateral leg. There it is. You can't miss it. All right, it has two names. First name is Fibularis Longus, and look, it wraps posterior to the lateral malleolus of the fibula, and the longest goes underneath deep to the plantar muscles of the foot and eventually attaches to the base of the first metatarsal plantarly. You can't see it because you got the plantar muscles here, and the medial cuneiform. All right, so that's Fibularis longus. There is a brevis which attaches right here to the base of the fifth metatarsal. You don't need to know that one. But there's the longest tendon right there. Follow it up, and there's the Fibularis longus. What's the other name for it? Peroneus longus. So Fibularis longus or Peroneus longus, same name. And where tibialis anterior was dorsiflexion, this one is plantar flexion and eversion. So you take your foot, plantar flex, and evert, turn it out. Okay? Probably can't see my foot, but you turn it out. Eversion. Okay? Plantar flexion, eversion of the foot is Peroneus longus. All right, so your book says on page 218, origin is head and upper portion of fibula. So just put head of fibula. Insertion is going to be the base of the first metatarsal plantarly as well as the plantar aspect of the medial cuneiform. Insertion is plantar flexion and eversion. And by golly, we are done. That is everything. Everything on your handouts. All right? Not 600 muscles, but definitely 2 pages of muscles. Good luck. Study hard. Patience, perseverance, and strength. You got PPS? Well, you will. You have to get through anatomy. All right, see you on the other side of the practical and the quiz. Keep up the good work. Bye.